Well, the numbers are shocking, to say the least. 1 in 3 people will get cancer in their lifetime. It's also the second leading cause of death here in the U.S. February is National Cancer Prevention Month. So here to talk about all that, Dr. Cynthia Cantu. She is a primary care physician with UT Health San Antonio. She's one of the miracle workers, as we like to call our friends in the medical field. Number one, Doc, let's get right to this. I want to give you as much time as possible. Biggest cancer concerns for men and women. And maybe put in simpler terms, what are the ones that you absolutely don't want?
Well, I think just in general, you do not want to have cancer. And so the biggest cancer concern for men and women is just cancer in general. All cancers it's scary for everyone. And so I can't say that one is going to be less scary. But fortunately, there's a lot of cancer screenings available for patients. And they definitely do help save lives.
I want to get to the screenings, but first I want to ask you about the risks. And I think folks know, hopefully they do at this point, but obviously smoking, any sort of tobacco products, staying out in the sun a lot for skin cancer, 2 different types of cancer there. But what are some of the big risk factors when it comes to all types of cancers?
Yes. So obesity, unfortunately, also is a big risk factor for cancer. So eating a healthy diet is very important, regular exercise, as well as making sure you're staying up to date with your vaccines, hepatitis B vaccine and HPV vaccine. And then also avoiding alcohol or decreasing your alcohol intake will also decrease your susceptibility to cancer. And as always, making sure you're following up with your primary care physician.
So how many times should a grown man or woman, once a year, twice a year? What's the proper amount of times to go visit not a pediatrician, but a doctor themselves?
So at least yearly for your physical, and then your primary care clinician will determine if you have to go sooner, depending, of course, if you have other chronic diseases that also can put you at risk for cancer.
Okay. I want to go back to the screenings. You alluded to that. Which ones help the most when it comes to both men and women?
Yes. So thankfully, there's a variety of screenings. For females, there's cervical cancer screening. There's also mammograms available. And then for both men and women, we have colon cancer screening, and there's multiple modalities. There's stool test, and the most common one that we always tend to look for is the colonoscopy.
If anybody takes anything away from this, and I hope they take more than just one thing, but Doc, when somebody hears that they have cancer, what's your advice to them? What's the best way to approach or attack it after they hear those words, you have cancer?
Well, making sure that you have, as you know, being part of UT, we have great team of clinicians that help coordinate your care. So that's one, you must be under a multidisciplinary team. And then the other thing, making sure you're now adapting, healthy diet, exercise, and making sure that you're following the recommendations from your primary care clinician and oncologist.
Best time to start is right now. It is National Cancer Prevention Month, all February long, but that is a prevention that we can do every day, every month, every year. She is Dr. Cynthia Cantu from UT Health San Antonio, one of the miracle workers out there. Doc, thank you so much.
Thank you.
Thank you. We'll be right back.